Good morning, I'm Dr. Christopher Baker, Director of Endovascular Surgical Neuroradiology at Hoag Hospital in Newport Beach, California. What we do is a combination of radiology and neurosurgery, where we use imaging guidance to perform minimally invasive surgical procedures that address problems involving blood vessels, the brain and spine, like acute stroke and brain aneurysm. We've got some interesting things on our schedule today that I think you'll find interesting. Give you a glimpse of what it's like to be a neurointerventionalist. I hope you enjoy it. Welcome to a day in my life. Okay, so today's schedule doesn't look too busy, but we do have some interesting things that we'll be looking at. Our first patient is a woman with an unruptured brain aneurysm that needs to be fixed so that we can eliminate the chance that it's going to bleed and potentially cause a catastrophic neurologic injury. We'll be using a newer device that's been available for a little while. I'm one of a very few number of surgeons in Southern California that's been trained on this device, but it is really ideal for this sort of aneurysm, especially since it would be technically quite challenging to get a good, long-lasting result with some of our other endovascular techniques.
All right, Cheryl. So we talked about this aneurysm the other day after your angiogram, and I showed you the pictures, kind of went through everything. And this, what I've got here is the little device that we're going to put in that aneurysm. It's called a web device, right?
Okay.
Nice and soft.
Yeah.
And it conforms to the shape of the aneurysm. And the mesh that it's made out of will block off the aneurysm and occlude it completely so that there's no more blood flowing in there. And that will cause the aneurysm to heal, and then the chance that it's going to rupture will be essentially eliminated. All right?
Great.
So I was about to scrub and get started fixing this aneurysm when I got called from the ER about a patient that is having stroke symptoms. He just got his imaging. You can see it on the screens behind me. Some advanced technology that allows us to evaluate blood flow to the brain when there's a clot that has gone to the brain and is blocking one of the larger arteries. And what you can see on that screen there, that blue area, is the part of his brain that is affected by that blood clot. Fortunately, there is no permanent damage yet, but if we don't get that clot out sooner or later, and usually sooner, that part of his brain will be permanently damaged, and he will lose all of the function on the right side of his body as well as his language abilities. That is a potentially devastating injury. So it turns out my colleague Dr. Mespan was here today and was able to go see that patient coming into the emergency department with an acute stroke. So I was able to continue on treating this aneurysm. Everything fortunately went really well. Got a really good result. I'm really happy with it, and I'm going to go talk with her husband John here in a moment.
Hey, John. Hi. How are you? I'm doing great. Everything went really well.
Okay.
We got a really good result.
Yeah.
It was a little bit tricky because of how we were talking about the shape of the aneurysm and how
Right.
it growing
Have
out
it on the top, yeah.
Exactly. But in the end, we were able to get that little basket, that web device, sitting there nicely. And by the time we were done getting it all positioned properly, there was no more flow going into the aneurysm, which is what we wanted.
Really good. And no serious complications along the way. Everything seemed to go just
Nice
fine.
and smooth,
Excellent.
no hiccups.
Excellent. I'm so happy to hear that.
All right.
Your little elbow. I appreciate that. Good. That makes me feel so much better.
All right. Hello again. It's kind of the end of the day here. Just stopped by the Neurosurgical ICU, check on a couple of patients. Had a couple of aneurysm ruptures that came in last week, and so I wanted to check on them. And also checked on the stroke patient that came in earlier today. He's doing remarkably better. That's a great thing. So right now I'm on my way up to round on Cheryl, who we treated earlier today. From what I hear so far, she's doing well also. So all in all, it's been a good day, I think. Busy, but good. Well, today certainly was a little more interesting than we expected, but fortunately our stroke patient is doing very well with no residual symptoms and should get to go home sometime in the next few days. Also, our aneurysm patient is doing very well, and I expect that she should get to go home in the morning. I will follow up with her in clinic in the next couple of weeks to answer any questions, go over the procedure with them, and also arrange for the appropriate imaging follow-up so that we ensure that what we've done today with this repair is permanent. So that's what it's like as a neurointerventionalist. I hope it was interesting and that you enjoyed it. And I also hope that we don't see you anytime soon. But if you do, there's no place like Hoag.